Diagnosing Irritable Bowel Syndrome. Irritable bowel syndrome, or IBS, is a condition that causes abdominal pain and discomfort associated with changes in your bowel habits. 5 to 10% of people worldwide have IBS. IBS does not shorten your life, but it can greatly impact your quality of life. Symptoms can cause you to lose time from work, miss activities you enjoy, and experience a great deal of discomfort. IBS is normally diagnosed after a full discussion with your healthcare provider about your symptoms, your health history, and a physical examination. Your healthcare provider will also check for signs of a more serious condition. You might need some basic tests to make sure another disorder is not causing your symptoms. You can prepare for seeing your healthcare provider by learning about IBS and making a list of questions to ask. Write down your symptoms, when they began, and triggers that make them better or worse, evaluations you have had done, labs, scans, and endoscopies, treatments tried, and questions. You may bring a family member or friend to help remember questions and keep track of answers. Some symptoms, called alarm signs, could indicate a serious condition other than IBS. These include blood in bowel movements, fever, chills, night sweats, diarrhea that wakes you from sleep, and weight loss. Your healthcare provider may notice alarm signs, including a low number of red blood cells called anemia, a lump or mass that can be felt, or symptoms starting when you are over 50. If you have alarm signs, your healthcare provider may recommend additional testing to rule out other conditions. Many people get symptom relief after working with their primary care providers. If you don't, or you have other symptoms that do not fit the diagnosis of IBS, you may be referred to a gastroenterologist who specializes in digestive disorders such as IBS. IBS symptoms can look like those of other digestive disorders. You may also have different symptoms at different times. Not all healthcare providers may be familiar with or comfortable diagnosing IBS, which can delay diagnosis. This is one reason it may help to see a healthcare provider who is experienced in treating IBS. You may not need many tests at first. If you do, the tests will likely depend on the type of IBS you have. If you mainly have diarrhea or IBS-D, you may be screened for celiac disease, low blood count, inflammation in the blood or stool, and infection. You may also have a breath test to learn if you are intolerant to certain carbohydrates or to check for too much of certain bacteria in your digestive system. If you mainly have constipation or IBS-C, you may have tests to measure muscle reflexes and pressure changes during bowel movements. You may also have a GI transit study or gastric emptying study to learn how quickly things pass through your digestive system. You may have blood tests if you have both diarrhea and constipation or IBS mixed. If you have weight loss, rectal bleeding, or abnormal lab test results, your healthcare provider may recommend an upper endoscopy or colonoscopy. These tests allow them to see inside the digestive system for inflammation or cancer. This is because IBS can have similar symptoms to other digestive system disorders, including celiac disease, Crohn's disease, and colitis. It's important to remember that IBS can often be diagnosed without extensive testing. Tell your healthcare provider about all your symptoms, even if they seem embarrassing. You can learn more about how IBS is diagnosed from the International Foundation for Gastrointestinal Disorders. Effective treatments are available for IBS and other digestive disorders. If you have alarm signs, it is important to see a healthcare provider as soon as possible. Learning more and talking with your provider are important steps towards better health.